Different paths to health insurance in California. Hello, I am Kevin Canals, a licensed independent health insurance agent in California, and finding health insurance can be a little bit confusing because it's not something we do all the time. And when your circumstances change, it's kind of like, well, where do I go? Who do I talk to? What are my different options? So I'm going to give just a kind of overview of some of the different types of health insurance that you might be eligible for and be able to explore. The first is Medi-Cal. And Medi-Cal is operated by the Department of Healthcare Services. And for generally people that are under 65, it is open year-round, so you can apply at any time. You don't have to worry about any open enrollment periods. And it is income-based. We call it Modified Adjusted Gross Income, MAGI Medi-Cal, which is the expanded Medi-Cal. So again, just based on your income. And if the adult makes less than 138% of the federal poverty level, they would qualify for Medi-Cal in their county, and the plans are zero cost for the premiums and zero cost for the health care services. Pregnant women can make up to 213% of the federal poverty level and then go into a full scope Medi-Cal. Children within a household, the household can earn up to 266% of the federal poverty level, and the children would be covered. Now, the Medi-Cal does include some dental benefits, Denti-Cal, I believe they call it, and there's also vision benefits for children. Now, the Medi-Cal plans are HMO, and they're based on the county in which you reside. So if you do move, you need to let the county know that you're moving so they can transfer your case to another county where there may be a different plan for you to enroll in. The easiest way to get into a Medi-Cal or to see if you qualify is to go through Covered California. That's coveredca.com. And when you put in all the information with a very low income, you and or your children will be determined eligible for Medi-Cal, and the information will be sent over to your respective county for final approval and enrollment. The next path for many people is what they call IFP, the Individual and Family Plan Marketplace. And these are private health insurance companies, and they operate in all of the counties of California. Not all plans are offered in all counties, and sometimes there are zip code restrictions. However, under the Affordable Care Act, pre-existing conditions are not considered, and you cannot be denied because of a pre-existing condition. And there's no rate increase if you do have a pre-existing condition. The rates are based on your age and where you live, your zip code. And the health insurance rates are a little bit higher in Northern California than they are in Southern California. All of the plans include pediatric dental and vision benefits. There are no adult dental or vision benefits within the individual and family plans. And there are no income restrictions. So, you can just enroll, and if you can afford the full premium, then you're on your way. Open enrollment occurs November through January in California. And again, you just go and you apply, and you are enrolled, and as long as you're making your premium payments, it's all good. You can enroll during the middle of the year if you have a qualifying life event, such as loss of coverage. Maybe you had an employer plan and you lost that, or you were in Medi-Cal and your income has gone up, and now you're into the individual and family plan marketplace. So qualifying life event, loss of coverage, moving into California, there's many of them. Now, one thing that is interesting is you can have both Medi-Cal and a private plan. And sometimes when you're out looking around for health insurance, you find some of these Native American grinding holes in the granite here out at Folsom Lake as just a reminder that we were not the first people here. Within the individual and family plan market operates Covered California. And Covered California is where people go to become eligible for the subsidies, the premium tax credit subsidies that lower the monthly health insurance premiums. Now, virtually all of the health plans that are offered what we call off exchange, direct from the carrier, are also offered through Covered California. The benefit structures are the same. The rates are essentially the same, except for the silver plans on Covered California are inflated by 5 to 10%. There's particular reasons for that. But with Covered California, again, no pre-existing conditions clause. The provider network is the same whether you enroll through Covered California or off exchange direct with the carrier, and the drug coverage is the same. So, I mean, they pretty much mirror between off exchange and Covered California. The subsidies through Covered California are based on the household size and the income, and there's other conditions that you have to go through the application. The open enrollment period is the same, just like for the off-exchange plans, November through January. You just go in and you enroll. Once you're in there, then you're kind of locked in for the year. You can't really change plans. You can come into Covered California with a qualifying life event such as loss of coverage, and then you can have the plan started. And of course, you can apply for Medi-Cal through Covered California. And sometimes when you go through Covered California, adults may be eligible for the subsidies, but because of the household income, the children may go Medi-Cal. So that's one thing to think about. You have to look at the income. And adults may have a private plan and children can be on Medi-Cal, but the children can also have a private health insurance plan. Now, probably the largest sector where most people get their health insurance is through an employer, and there's many different employer plans. And they break them up into small group and large group. There's union plans, self-funded plans. Generally, the employer group health plans have a larger network of providers than the individual and family, and certainly different from Medi-Cal. And there are many PPOs to select from. And it is nice. The employer plans, you know, there's usually more hospitals and doctors. And so it's kind of nice if you have an employer plan because you have a greater variety of doctors and facilities to have your health care services delivered to you. No denial for pre-existing conditions. Now, there may be some waiting periods with employer health insurance. When you're initially hired with a plan, with a company, you may have to wait up to 60 days before you can enroll in that employer group plan. And that's where you may pick up one of those off-exchange plans or Covered California for a couple months before the employer plan kicks in. Now, the employers make a contribution to the employee's coverage to make it, you know, more affordable. They do not always make a contribution to the spouse or dependents, and that can make it really unaffordable if you're having to pay the full rate of the employer plan. Now, they've changed the rules, and right now, if the cost of the lowest cost bronze plan offered to the employee for the household, employee, spouse, and dependents, if that rate is greater than 8.39% of the household income, spouse and dependents can go through Covered California and get the subsidies. Now, kind of the last segment of where people may be getting health insurance is Medicare, and that is generally for people who are 65 years old and qualify for Medicare, original Medicare Parts A and B. Some people will be awarded Medicare because they are disabled, and if you are determined disabled by Social Security for 24 months, then you will be granted Medicare Parts A and B. There's generally zero cost for Part A if you have worked for more than 10 years or if your spouse has. There is a premium for Part B. Right now it's about $175 in 2024. If you are entitled to Part A of Original Medicare, you are ineligible for the subsidies through Covered California because it's considered minimum essential coverage. There are some instances with group plans where you must enroll in Original Medicare, and that's generally small employer groups where there's only 20 employees or so. Otherwise, if it's a larger group, you can stay enrolled in that employer group. You still have Part A, that's no cost, no big deal. But then again, you do not have to enroll in Part B because the employer plan would be covering those outpatient services and the prescription drug coverage. And of course, some people stay enrolled in their employer plan because their spouse is not yet 65 and eligible for Medicare. Now, Original Medicare does not cover prescription medications, so you need to pick up a Part D prescription drug plan to have those covered, or if you enroll in a Medicare Advantage plan, the prescription drugs will be covered as well. And you can have Medicare and Medi-Cal, but in those situations, Medi-Cal is just picking up the cost sharing. Medi-Cal is not the health plan. Medicare, or the Medicare Advantage plan, is the health plan. Medi-Cal is just covering some of the costs associated with Original Medicare and some of the premiums. So that's kind of the landscape that you will see in California if you are looking for health insurance. These are much larger issues, and if you have any questions or comments, you may leave those down below and I'll do my best to answer them. You can go to my website. I post lots of information on these different types of health insurance on there, and you can go to my contact page and contact me for additional information. Otherwise, for insuremekevin.com, I'm Kevin Canals.